Imagine that every second can be the difference between a healthy life and a devastating medical emergency. Do you know the warning signs of a stroke? If you knew that simple lifestyle adjustments could reduce this risk, would you make them? Subscribe to the channel for more updates and enjoy this video if it is useful to you. There's another way to support our content. See the comments. Make a difference to someone's health by enjoying this video. Your collaboration helps us bring health information to more people. A stroke, commonly known as a brain attack, is a serious medical condition that occurs when the blood supply to a part of the brain is interrupted or reduced, preventing brain tissue from receiving oxygen and nutrients. This can result in the death of brain cells within minutes, making a stroke a medical emergency that requires immediate attention. There are two main types of stroke: ischemic, caused by a clot that blocks or narrows an artery leading to the brain, and hemorrhagic, caused by an artery that ruptures and bleeds into the brain. The importance of recognizing the signs of a stroke and seeking immediate medical attention cannot be overstated, as quick response can mean the difference between significant recovery and permanent disabilities or even death. The warning signs of a stroke include paralysis or numbness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding speech, vision problems in one or both eyes, difficulties walking, dizziness, loss of balance or coordination, and severe headache with no known cause. Knowing these signs and acting quickly upon identifying them can not only save lives, but also minimize long-term brain damage, allowing for more effective rehabilitation. Signs and symptoms of stroke. Immediate recognition of the signs of a stroke is crucial for the effectiveness of treatment and for minimizing permanent brain damage. One of the most evident signs is sudden paralysis or numbness in the face, arm, or leg, especially on one side of the body. This manifestation may be accompanied by a tingling sensation or total loss of sensitivity. Another common sign is sudden difficulty in speaking or understanding what others are saying, which may make the person appear confused or speak in a slurred and incoherent manner. Sudden changes in vision, such as blurred vision, double vision, or vision loss in one or both eyes, are also alarming signs that a stroke may be occurring. In addition to these symptoms, individuals experiencing a stroke may face sudden difficulty walking, loss of balance or coordination, which can lead to falls or a staggering gait. A severe and unexplained headache is another symptom that may indicate a stroke, especially if accompanied by other signs. In some cases, there may also be sudden dizziness, which should not be ignored. It is essential to understand that a stroke is a medical emergency and that any of these signs require an immediate response. Upon identifying one or more of these symptoms, it is vital not to wait to see if they disappear on their own and to seek medical help immediately to increase the chances of complete recovery and reduce the risk of serious sequelae. Risk factors for stroke. Various risk factors contribute to the increased likelihood of experiencing a stroke, and understanding these can aid in prevention. Risk factors can be divided into two categories: non-modifiable and modifiable. Among the non-modifiable ones are age. The risk of stroke increases with age. Sex. Men have a slightly higher risk of stroke than women, although women are more likely to die from a stroke. Family history of stroke, and race. People of African descent have a higher risk of stroke than those of other races. These factors are inherent to the individual and cannot be changed, but knowledge and monitoring of them are essential for an effective prevention strategy. On the other hand, modifiable risk factors are those over which we have control and can intervene to reduce the risk of stroke. These include high blood pressure, which is the main risk factor for stroke, diabetes, high cholesterol levels, obesity, and physical inactivity. In addition, behaviors such as smoking, excessive alcohol consumption, and a diet poor in nutrients and rich in salt and saturated fats also significantly increase the risk of stroke. Controlling these factors through lifestyle changes, such as adopting a healthy diet, exercising regularly, maintaining a healthy weight, and avoiding tobacco and excessive alcohol consumption, can significantly lower the likelihood of having a stroke. Medical management of conditions such as high blood pressure and diabetes is also crucial in preventing strokes. Impact of food on cardiovascular health. Diet plays a key role in cardiovascular health, directly influencing the risk of developing conditions such as stroke and other cardiac complications. Foods high in saturated fats, cholesterol, and salt can significantly increase the risk of cardiovascular diseases by contributing to the formation of atherosclerotic plaques in the arteries, which can lead to atherosclerosis. Atherosclerosis narrows and hardens the arteries, reducing blood flow and increasing blood pressure. Additionally, diets high in simple sugars and refined carbohydrates can contribute to type 2 diabetes, a known risk factor for stroke. Therefore, a poor diet can not only directly affect the arteries, but also influence conditions that are precursors to serious cardiovascular events. In contrast, a diet rich in fruits, vegetables, fiber, fish, and unsaturated fats can have a protective effect on the heart and brain. Foods like omega-3 rich fish, such as salmon and sardines, can help reduce triglyceride levels and promote healthy arterial health. Fruits and vegetables contain a variety of vitamins and antioxidants that combat inflammation, a key factor in the prevention of atherosclerosis. Additionally, incorporating whole grains and fiber sources into the diet helps improve cholesterol levels and regulate blood sugar, both critical for maintaining cardiovascular health. Thus, a balanced diet not only reduces the risk of stroke, but also supports a healthy cardiovascular system, reducing the risk of other chronic diseases related. Diet and disease prevention. Adopting a balanced diet is essential for the prevention of stroke, AVC, and other chronic diseases. The Mediterranean diet, for example, is widely recommended by health professionals due to its high content of whole foods, fruits, vegetables, nuts, seeds, legumes, and olive oil, and moderate consumption of fish and poultry. This type of diet emphasizes the use of healthy fats and the reduction of red and processed meats and whole dairy products. Studies show that following the Mediterranean diet can significantly reduce the risk of cardiovascular diseases as it helps maintain cholesterol and blood pressure levels under control. In addition to promoting glycemic balance and fighting inflammation in the body, all factors that contribute to cardiovascular health. Another beneficial dietary pattern is the DASH diet, dietary approaches to stop hypertension, which was specifically developed to combat hypertension, one of the major risk factors for stroke. The DASH diet focuses on reducing sodium intake and increasing consumption of foods rich in potassium, calcium, and magnesium, such as vegetables, fruits, whole grains, and lean proteins like fish and chicken. Reducing sodium intake is crucial, as excessive salt in the diet is directly related to increased blood pressure. Combining these dietary approaches with other lifestyle changes, such as maintaining a healthy weight, not smoking, and engaging in regular physical activities, can maximize protection against stroke and other cardiovascular diseases. Implementing these changes not only improves overall health, but also can increase longevity and quality of life. The importance of exercise in disease prevention. Regular physical exercise plays a key role in maintaining cardiovascular health and preventing diseases such as stroke, AVC. Activities such as walking, running, cycling, swimming, and strength training significantly contribute to the improvement of cardiac function, increased blood circulation, and reduced blood pressure. These effects are vital for reducing the risk of clot formation or blockages in the arteries, which are common causes of ischemic strokes. Additionally, regular exercise helps control weight, reduce LDL cholesterol, the bad cholesterol, and increase HDL cholesterol, the good cholesterol, thus balancing critical factors that affect cardiovascular health. Another benefit of exercise is its ability to improve blood glucose regulation and increase insulin sensitivity, which is especially important for preventing or managing type 2 diabetes, a condition that significantly increases the risk of stroke. Beyond the physical benefits, physical exercise also promotes mental health, reducing stress, anxiety, and depression, conditions that can adversely affect cardiovascular health. Including physical activities in the daily routine is an effective strategy not only for stroke prevention, but also for improving overall quality of life, providing a holistic approach that benefits both body and mind. Therefore, adopting an active lifestyle is essential for cardiovascular health and the prevention of a range of chronic diseases. Stress. Chronic stress is a significant risk factor for various cardiovascular conditions, including hypertension, heart attacks, and strokes, AVC. When a person is stressed, their body releases hormones like cortisol and adrenaline, which prepare the body for a fight or flight response. Although useful in acute situations, prolonged exposure to these hormones can wear out the body, especially the cardiovascular system. This is because chronic stress keeps the body in a state of high alert, which raises blood pressure and increases the strain on the heart. Additionally, stress can lead to unhealthy behaviors such as smoking, excessive alcohol consumption, and poor diet, exacerbating cardiovascular health risks. To manage stress and mitigate its harmful effects on health, it is important to adopt effective stress reduction strategies. Relaxation techniques such as meditation, yoga, and deep breathing have proven effective in reducing stress levels and promoting a general sense of well-being. Additionally, regular physical activities not only help reduce stress, but also strengthen the heart and improve cardiovascular health. Having a solid social support network and seeking professional help to manage stress are also valuable approaches. Specifically, cognitive behavioral therapy, CBT, can help individuals identify and change thought patterns that contribute to stress, offering long-lasting tools for coping with daily tensions. Adopting these strategies can be a crucial part of a healthy lifestyle, protecting the heart and reducing the risk of cardiovascular diseases. Smoking and alcohol consumption. Smoking is one of the leading modifiable risk factors for stroke, AVC. Smoking acts in various ways to increase the risk of stroke. It damages the walls of blood vessels, increases plaque formation, thickens the blood, and raises the likelihood of clot formation. Moreover, nicotine raises blood pressure, while carbon monoxide reduces the amount of oxygen that the blood can carry, forcing the heart to work harder to supply the body with the necessary oxygen. Quitting smoking is one of the most effective measures to reduce the risk of stroke, with the risk significantly decreasing within the first few years after stopping the habit. Studies show that ex-smokers eventually return to the same stroke risk as people who have never smoked, emphasizing the importance of quitting this habit for cardiovascular health. On the other hand, excessive alcohol consumption is also a significant risk factor for stroke. Drinking large amounts of alcohol can lead to several conditions that predispose to stroke, such as high blood pressure, cardiac arrhythmias, liver disease, and increased blood fat levels. Alcohol can contribute to clot formation by affecting platelet function and can also cause direct damage to the walls of blood vessels. Moderating alcohol consumption or abstaining entirely, especially in cases of previous excessive use, can significantly reduce the risk of stroke. Medical guidelines generally recommend limiting alcohol intake to no more than 2 alcoholic drinks per day for men and 1 for women as part of a heart-healthy lifestyle. Primary and secondary stroke prevention. Primary stroke prevention involves interventions aimed at preventing the initial occurrence of a stroke, focusing primarily on modifying controllable risk factors. Managing high blood pressure is the most critical measure, as it is the single largest risk factor for both ischemic and hemorrhagic strokes. Maintaining healthy blood pressure can be achieved through a balanced diet, rich in fruits and vegetables and low in salt and saturated fats, in addition to the use of antihypertensive medications as prescribed by a healthcare professional. Other important measures include controlling diabetes, reducing cholesterol levels, quitting smoking, limiting alcohol consumption, maintaining a healthy body weight, and regularly engaging in physical activities. These strategies help not only prevent stroke, but also improve overall health and quality of life. Secondary stroke prevention is aimed at preventing recurrence in individuals who have already experienced a stroke or a transient ischemic attack, TIA, which is often a precursor to more severe strokes. This approach includes many of the same strategies as primary prevention, such as strict control of blood pressure and cholesterol, as well as additional measures such as anticoagulation for patients with atrial fibrillation and the use of antiplatelet agents to prevent the formation of new clots. Rehabilitation is also a crucial part of secondary prevention, involving physical, occupational, and speech therapy to improve function and independence after a stroke. Continuous monitoring and medical follow-up are essential to adjust treatments and ensure that patients maintain a lifestyle that minimizes the risks of another stroke. Importance of regular checkups. Regular checkups are crucial for the early detection of health conditions that may increase the risk of a stroke. During these examinations, doctors can assess blood pressure, cholesterol levels, and blood glucose, among other vital markers that indicate cardiovascular risk. Hypertension, for example, often shows no obvious symptoms, but can be identified during a routine examination. Early detection and treatment of hypertension are critical to prevent damage to the blood vessels that can lead to a stroke. Similarly, elevated cholesterol levels can be managed with dietary changes and, if necessary, medications that help prevent the formation of plaques in the arteries, another common cause of strokes. In addition to measuring physical indicators, regular checkups also provide an opportunity for patients to discuss lifestyle habits and any new or concerning symptoms with their doctors. This dialogue can lead to the investigation of other underlying conditions, such as atrial fibrillation or diabetes, which also increase the risk of stroke. Doctors may recommend lifestyle changes or initiate preventive treatments that significantly reduce the risk of a stroke. Therefore, maintaining a regular schedule of medical exams is not just a preventive measure for cardiovascular health, but a proactive strategy for overall health and long-term well-being. First aid for stroke. When someone shows signs of a stroke, it is crucial to act quickly to maximize the chances of recovery and minimize permanent damage to the brain. The first signs include sudden paralysis or numbness in the face, arm, or leg, especially on one side of the body, confusion, difficulty speaking or understanding, vision problems, difficulty walking, loss of balance or coordination, and severe headache with no known cause. If these symptoms are observed, it is essential to immediately call an ambulance. While waiting for medical assistance, it is important to keep the person calm and lying down in a comfortable position with their head and shoulders slightly elevated if possible, and turn to the side to prevent choking if they vomit. In addition to calling for medical help, it is crucial not to give anything to the person to eat or drink, as the stroke may impair their ability to swallow, increasing the risk of choking or aspiration, which can aggravate the situation. Monitoring vital signs, such as breathing and pulse, is also important while waiting for help. If the person is unconscious, place them in the recovery position, on their side, with their head supported so that the mouth and nose are unobstructed, ensuring that they can breathe. Noting the time when the first symptoms appeared can be crucial for health professionals to determine the most appropriate treatment upon arrival. Quick response in recognizing the signs of a stroke can be critical for the treatment outcome and the patient's recovery. Rehabilitation. After stroke. Rehabilitation after a stroke is a crucial part of the recovery process, helping to maximize the patient's function and independence. After initial medical stabilization, a personalized rehabilitation plan is usually developed by a multidisciplinary team that may include neurologists, physical therapists, occupational therapists, speech therapists, psychologists, and social workers. The goal is to help the stroke survivor recover as much of their physical, cognitive, and emotional ability as possible. Physical therapy helps improve muscle strength and coordination, while occupational therapy focuses on daily skills to promote independence. Speech therapy is vital for those facing communication or swallowing issues, and psychological support helps manage emotional and behavioral changes that may occur after a stroke. The rehabilitation process is typically intensive and prolonged, varying significantly from person to person, depending on the severity of the stroke and the areas of the brain affected. Rehabilitation sessions may begin in the hospital and often continue in specialized facilities or at home, under the guidance of professionals. Assistive technologies, such as walkers and adaptive devices, may be used to facilitate mobility and daily activities. Additionally, innovative interventions, such as robotic therapy and neuromuscular electrical stimulation, are becoming increasingly common, providing new hopes and possibilities for recovery. It is essential that rehabilitation begins as early as possible and is continuously adjusted as the patient progresses to ensure the best possible outcomes. This video explored essential aspects related to stroke, highlighting the importance of recognizing early signs and acting immediately to maximize the chances of recovery. Quick identification of stroke symptoms and agile response can make a significant difference in treatment outcomes, reducing the possibility of permanent damage. Additionally, we discussed how modifiable risk factors, such as hypertension, diabetes, and harmful habits like smoking and excessive alcohol consumption, can be managed through lifestyle changes. Primary and secondary prevention strategies were also addressed, emphasizing the importance of regular checkups and adopting a healthy diet and regular exercise for cardiovascular health. We encourage everyone to adopt a lifestyle that promotes heart health and reduces the risk of stroke. This includes maintaining a nutritious diet, rich in fruits, vegetables, and whole grains, and low in saturated fats and salt, engaging in regular physical activity, avoiding tobacco and excessive alcohol, and managing stress effectively. Additionally, it is crucial to seek regular medical follow-up to monitor health conditions that may increase the risk of stroke. By taking proactive steps to care for your cardiovascular health, you not only improve your quality of life, but also contribute to the prevention of serious conditions like stroke. Prevention is always the best strategy, and small changes can have profound impacts on your health and overall well-being. If you've made it this far, you know that small changes can be the key to a longer, healthier life free from diseases like stroke. But are you ready to turn this knowledge into action? Think of one thing you can change today to improve your health. Whether it's adjusting your diet, starting a physical activity, or perhaps scheduling that checkup you've been putting off, let us know in the comments what your first step will be, and share this video so others can also be inspired. Don't forget to subscribe to the channel to not miss our next health tips. We're in this journey together for a healthier life.